nurses and others who work there. But will it actually save lives? Even your views about the effects
of fire everybody that's unvaccinated and they're understaffed. It's
that's
clearly
what's
going to
so
kill
insane. Yeah, it's like whatever your views on potential, extremely statistically rare and unlikely, Susan, side effects of the vaccine, you also have the effect of not enough people to take care of you at the hospital. To the point that this is maybe the most insane, absurd thing I've seen out of all of the absurdities in this entire episode of our history. Headline ABC News: health officials let COVID-infected staff stay on the job. Okay, so just to be clear, what's happening across states now is they're firing unvaccinated healthy people, telling them they're too dangerous to do the job. But if you're vaccinated and you have corona, you tested positive, you're a doctor or a nurse who has corona, or other hospital staff, you have corona, and you can have mild symptoms. You can be symptomatic. You can have the sniffles. You can be sneezing, coughing. They want you back on the job.
That's moronic. Your level of symptoms is not correlated with like the severity of the disease, is it? Or the transmissibility of the disease?
Everybody's transmitting Omicron. Everybody.
Who cares?
Vaccinated, unvaccinated, symptomatic, asymptomatic. It's like Oprah. You get Omicron, we're all getting Omicron. Nobody's not getting it.
Yeah.
But just what an insult. If you're the sort of person, let's say you were a nurse who was in fact overworked last year in New York City or some place where it was a lot more crowded than, say, more rural parts of the country, like where we live. You actually did the hard work through all of this before the vaccine was even available, and they turn around and fire you and then insult you by allowing sick people to work because you wouldn't take the vaccine.
Yeah.
There's someone explain this to me. Someone who supports this policy needs to explain it to me. How is it safer for actually sick people who are symptomatic with a highly transmissible virus? How is it safer for them to be working than people who are not sick but haven't taken your precious miracle vaccine?
Yeah, they don't have evidence. They just know that those people will comply to whatever dumbass mandate they can shove down their throats in future.
Yeah, I suppose you're right. This is just a proxy for submission. It's a proxy for do as you're told. It's a proxy for controllability.